A preterm infant born at 26 weeks gestation is observed having episodes where she stops breathing for more than 20 seconds, accompanied by a noticeable drop in heart rate and oxygen saturation. These episodes started approximately 48 hours after birth in the Neonatal Intensive Care Unit, NICU. The clinical team has placed the infant on continuous cardiorespiratory monitoring with a pulse oximeter, which has documented several episodes of apnea, bradycardia, and oxygen desaturation. Which of the following is the most likely diagnosis for this infant? A. Apnea of prematurity. B. Neonatal sepsis. C. Congenital heart disease. D. Gastroesophageal reflux disease. The correct answer is A. Apnea of prematurity. Apnea of prematurity is common in preterm infants and is defined by cessations in breathing that last for more than 20 seconds or shorter pauses associated with bradycardia and/or oxygen desaturation. It is usually due to the immaturity of the respiratory control center in the brain. In this case, the infant's premature birth at 26 weeks makes her particularly susceptible. The breathing cessation episodes observed align closely with apnea of prematurity, which typically presents within the first days of life in preterm infants. It manifesting before 37 weeks gestational age further supports the diagnosis. Moreover, apnea of prematurity normally resolves by 37 weeks postmenstrual age in more mature. Thank you for participating in this case review. Understanding the presentation and characteristics of apnea of prematurity helps in effective monitoring and appropriate management in the NICU. Stay tuned for more case-based insights in pediatric care.